Welcome to our channel, where we bring you informative and insightful content on a variety of health topics. Today, we're going to be discussing the thyroid gland and its impact on our overall health. The thyroid gland is a small, butterfly-shaped gland located in the neck that produces hormones that regulate our metabolism and other vital bodily functions. When the thyroid gland isn't functioning properly, it can lead to a range of symptoms and health issues. In this video, we'll be taking a closer look at the causes of thyroid dysfunction, including autoimmune disorders and nutrient deficiencies. We'll also explore the common symptoms of thyroid dysfunction, such as fatigue, weight gain, and hair loss, and how they can impact your day-to-day life. Additionally, we'll discuss the various diagnostic tests that healthcare providers use to determine whether you have a thyroid disorder, including blood tests and imaging studies. Finally, we'll delve into the various treatment options for thyroid disorders, including medications, surgery, and lifestyle changes. By the end of this video, you'll have a comprehensive understanding of the thyroid gland, its role in the body, and how to identify and manage thyroid disorders. So sit back, relax, and let's dive into the fascinating world of thyroid health. Thyroid hormone functions. What does the thyroid do? The thyroid is an endocrine gland located in the neck, just below the Adam's apple. Its primary function is to produce hormones that regulate the body's metabolism. The two main hormones produced by the thyroid gland are triiodothyronine T3 and thyroxine T4, which are secreted into the bloodstream and affect almost every cell in the body. The thyroid hormones play a vital role in regulating the body's metabolism, which includes processes such as heart rate, body temperature, and energy production. They help to control the rate at which the body burns calories and converts food into energy, and they also play a role in growth and development, especially in children. When the thyroid gland is not functioning properly, it can lead to a range of health problems, such as hypothyroidism and underactive thyroid, hyperthyroidism, and overactive thyroid, or thyroid cancer. Some common symptoms of thyroid problems include fatigue, weight changes, hair loss, and changes in heart rate and body temperature. Thyroid hormone functions. Thyroid disease refers to any medical condition that affects the thyroid gland, a small butterfly-shaped gland located in the neck. The thyroid gland produces hormones that regulate the body's metabolism, and when it doesn't function properly, it can lead to a range of health problems. There are several types of thyroid disease, including hypothyroidism. This occurs when the thyroid gland doesn't produce enough thyroid hormone, which can slow down the body's metabolism and lead to symptoms such as fatigue, weight gain, and depression. Hyperthyroidism. This occurs when the thyroid gland produces too much thyroid hormone, which can speed up the body's metabolism and lead to symptoms such as weight loss, rapid heartbeat, and anxiety. Thyroid nodules. These are small lumps or growths that develop on the thyroid gland. Most nodules are non-cancerous, but in some cases, they may need to be biopsied or removed. Thyroid cancer. This is a relatively rare type of cancer that develops in the thyroid gland. It often presents as a thyroid nodule, but can also cause swelling in the neck or voice changes. Treatment for thyroid disease depends on the type and severity of the condition, and may include medication, surgery, or radioactive iodine therapy. Thyroid disease. Who's affected? Thyroid disease can affect people of all ages, genders, and ethnicities. However, certain factors can increase a person's risk of developing thyroid disease, including gender. Women are more likely to develop thyroid disease than men. Age. The risk of thyroid disease increases as people get older. Family history. Having a family member with thyroid disease increases the risk of developing the condition. Autoimmune disorders. People with autoimmune disorders, such as rheumatoid arthritis or lupus, have a higher risk of developing thyroid disease. Radiation exposure. Exposure to radiation, particularly during childhood, increases the risk of thyroid disease. Iodine deficiency. A lack of iodine in the diet can lead to thyroid disease, particularly in developing countries. Pregnancy. Pregnancy-related changes in hormone levels can lead to thyroid disease in some women. Overall, anyone can develop thyroid disease, but certain factors can increase a person's risk. It's important to talk to a doctor if you experience symptoms of thyroid disease or have risk factors for the condition. Causes of thyroid disease. Thyroid disease can be caused by a variety of factors, including autoimmune disorders. The most common cause of thyroid disease is autoimmune disorders such as Hashimoto's thyroiditis and Graves' disease. These conditions cause the immune system to attack the thyroid gland, resulting in either an underactive hypothyroidism or overactive hyperthyroidism. Thyroid. Genetic factors. Thyroid disease can also be caused by genetic factors. If someone in your family has thyroid disease, you may be more likely to develop it. Radiation exposure. Exposure to radiation, such as during radiation therapy for cancer, can increase the risk of developing thyroid disease. Medications. Some medications can interfere with thyroid function and lead to thyroid disease. For example, lithium, which is commonly used to treat bipolar disorder, can cause hypothyroidism. Nutrient deficiencies. An insufficient intake of iodine, selenium, or zinc can affect thyroid function and lead to thyroid disease. Pregnancy. Pregnancy can cause temporary thyroid problems, and women who have had thyroid problems in the past may be at higher risk of developing them again during pregnancy. It's important to note that sometimes the exact cause of thyroid disease is not clear. If you're experiencing symptoms of thyroid disease, it's important to see a healthcare provider for evaluation and diagnosis. Thyroid disease symptoms. Thyroid disease can cause a range of symptoms, which can vary depending on whether the thyroid gland is overactive or underactive. Here are some common symptoms associated with thyroid disease. Hyperthyroidism, overactive thyroid, rapid heartbeat or heart palpitations, increased sweating, nervousness, anxiety, or irritability, weight loss or difficulty gaining weight, fatigue or muscle weakness, difficulty sleeping, changes in menstrual patterns, frequent bowel movements or diarrhea, fine tremors in the hands and fingers, hypothyroidism, underactive thyroid, fatigue or exhaustion, weight gain or difficulty losing weight, cold intolerance, dry skin and hair loss, constipation, depression or mood changes, muscle weakness or stiffness, heavy or irregular menstrual periods. It's important to note that some people with thyroid disease may not experience any symptoms or only have mild symptoms, while others may have more severe symptoms. If you're experiencing any of these symptoms or have concerns about your thyroid health, it's best to speak with your doctor for proper evaluation and diagnosis. Thyroid disease diagnosis. The diagnosis of thyroid disease typically involves a combination of physical examination, blood tests, and sometimes imaging tests. During a physical examination, a doctor may check for physical signs of thyroid disease, such as a visibly enlarged thyroid gland, a tremor in the hands, or changes in the texture or appearance of the skin, hair, or nails. Blood tests are commonly used to measure levels of thyroid hormones, as well as other substances that can provide clues about thyroid function or autoimmune activity. These tests may include the thyroid-stimulating hormone (TSH) test, the free thyroxine T4 test, and the triiodothyronine T3 test, as well as tests for antibodies that may be present in autoimmune thyroid disease. Imaging tests, such as ultrasound or radioactive iodine scans, may also be used to visualize the structure and function of the thyroid gland, and to help identify any nodules or other abnormalities that may be present. Thyroid disease treatment. The treatment for thyroid disease depends on the specific condition and its severity. Here are the most common treatments for different types of thyroid disorders. Hypothyroidism. This condition is treated with thyroid hormone replacement therapy, which involves taking a synthetic thyroid hormone medication, such as levothyroxine, to replace the hormone that your thyroid gland is not producing enough of. Hyperthyroidism. The treatment options for hyperthyroidism include medications that decrease the production of thyroid hormones or medications that block the effects of thyroid hormones on the body. Another treatment option is radioactive iodine therapy, which involves taking a dose of radioactive iodine to destroy thyroid cells that are producing too much hormone. In some cases, surgery to remove the thyroid gland may be necessary. Thyroid nodules. If a thyroid nodule is found to be cancerous, the treatment is typically surgery to remove the nodule and any affected thyroid tissue. If the nodule is benign, treatment may not be necessary, but the doctor may recommend monitoring the nodule with regular ultrasounds. Thyroiditis. Treatment for thyroiditis depends on the specific type of thyroiditis. For example, if the thyroiditis is caused by a viral infection, treatment may involve managing the symptoms until the infection resolves. If the thyroiditis is caused by an autoimmune condition, the treatment may involve medications to suppress the immune system and reduce inflammation. It is important to work closely with your doctor to determine the best course of treatment for your specific thyroid condition. Thanks for watching this video on understanding thyroid health, causes, symptoms, and treatment options. In summary, the thyroid gland is a crucial part of the endocrine system that regulates several vital bodily functions, including metabolism, heart rate, and body temperature. When the thyroid gland fails to function correctly, it can lead to several health problems, including hyperthyroidism, hypothyroidism, thyroid nodules, and thyroid cancer. Some common symptoms of thyroid problems include weight changes, fatigue, hair loss, mood swings, and muscle weakness. However, these symptoms can vary depending on the type of thyroid disorder, and some people may not experience any symptoms at all. The good news is that there are several treatment options available for thyroid problems, including medication, surgery, and radioactive iodine therapy. However, it is essential to consult a healthcare professional if you suspect you may have a thyroid problem, as they can provide an accurate diagnosis and develop a tailored treatment plan based on your individual needs. Thank you for watching, and we hope you found this video informative and helpful. If you have any questions or comments, please leave them below, and don't forget to subscribe to our channel for more informative videos on health and wellness. In some cases, a fine needle biopsy may be performed to collect a sample of thyroid tissue for further examination under a microscope. Ultimately, the diagnosis of thyroid disease will depend on a careful evaluation of all of the available information, including the results of physical examination, blood tests, and imaging studies, as well as the patient's medical history and symptoms.